Hi students, welcome back to my channel Nursing Guru. In today's video, I will be covering heart failure, an essential topic for BSc Nursing students. I will keep it simple, clear and exam focused. Let us begin. Before starting with heart failure, we will see brief anatomy and physiology of heart. As we all know, heart is a muscular organ consisting of 4 chambers, namely right atrium, right ventricle and left ventricle. There are 4 valves: tricuspid, bicuspid, pulmonary and aortic valve. Then the wall of heart is consisting of 3 layers. They are pericardium, myocardium and endocardium. Then if we see the coronary arteries are the early branches of aorta. They supply blood to the heart. And if we see physiology, the function of heart is to pump the blood to all parts of the body to meet their needs. Then what is heart failure? Heart is said to be fail when it is unable to perform its function. Heart is said to be fail when it is unable to perform its function. What is the function of heart? As I told, the function of heart is to pump the blood. When the heart is unable to perform this function, then it is called as heart failure. Heart failure is the condition in which heart is unable to pump sufficient amount of blood to the body parts. Heart failure doesn't mean it is not working efficiently. Its meaning is it's performing its function but not efficiently. Heart failure, either it may be left-sided heart failure or right-sided heart failure or both sides. Next, we will move on to types of heart failure. We can classify heart failure into 2 main ways based on the part of heart is affected, that is side of heart affected, and another one is based on function. Based on the side of heart affected, the heart failure is classified into left-sided heart failure where the lungs are affected. Left-sided heart failure affects the lungs by causing fluid buildup in the pulmonary circulation that leads to shortness of breath, coughing and difficulty in breathing. Then right-sided heart failure is the one in which right side of the heart is failed, that is right atrium and right ventricle. Then the third classification is congestive heart failure where both sides of hearts are damaged or affected. Then based on function, the heart failure is classified into systolic failure where the heart can't pump blood strongly. In systolic failure, the heart can't pump strongly. In diastolic failure, based on function, second classification is diastolic failure where the heart can't fill properly. In a diastolic heart failure, the heart can't fill properly. Then if we see the causes of heart failure, some common causes include high blood pressure, coronary artery, heart attacks, valve diseases, arrhythmias or irregular beating, diabetes and cardiomyopathy. How high blood pressure causes heart failure? High blood pressure can cause heart failure because it forces the heart to work harder than normal. Over the time, this increased workload can cause the heart muscle to thicken and become stiff, making it difficult for the heart to pump enough blood to meet the body's needs. Then coronary artery disease. What is coronary artery disease? Coronary artery disease is the one in which coronary arteries are affected where there will be buildup of plaque in the coronary arteries. Coronary arteries where plaque buildup narrows the coronary arteries can lead to heart failure. Again, over the time, the narrowed arteries reduce blood flow to the heart, causing the heart muscle to weaken and struggle to pump. Eventually, this causes heart failure. Next, second cause is heart attacks. It is also called as myocardial infarction that can lead to heart failure by damaging the heart muscle and impairing its ability to pump blood effectively. Then the third cause is valve disease. When heart valve, I'm telling valves, not valves. When heart valves are not working properly, the heart has to work harder to compensate. Eventually, that leads to weakened heart muscle and reduced pumping ability. Then fourth cause I told, arrhythmias or irregular heartbeats. Irregular heartbeats also can lead to heart failure. Then fifth cause for heart attack I told, diabetes. What is diabetes? Diabetes is high sugar levels, high blood sugar levels. Even high blood sugar levels from diabetes can damage the lining of blood vessels, making them more vulnerable or more prone to plaque formation. Again, plaque formation leads to atherosclerosis. This can restrict blood flow to the heart, causes or leads to heart failure. That leads to coronary artery disease, that in turn leads to heart failure. Then in diabetes, nerve damage, even that is called cardiomyopathy. What is cardiomyopathy? Cardiomyopathy, it is a disease of the heart muscle, can cause heart failure. That is because it makes it harder for the pumping. Nerve damage or cardiomyopathy makes harder the heart for pumping the blood effectively. This is due to various changes in the heart muscle, such as thickening, stiffening or hardening of the heart valve, or it may be due to the enlargement of or weakening of the heart valve. That leads to or that affects the pumping of heart. Next, we will move on to signs and symptoms of heart failure. Now, let us compare symptoms of left and right-sided failure. What are the symptoms of left-sided heart failure? Breathlessness, that is called as the dyspnea, that is difficulty in breathing. Then there will be orthopnea. What is orthopnea? It is the shortness of breath. That happens when you are lying on your back, that is in supine position, you feel breathlessness. Then there will be cough with the pink frozen sputum. Pink colored sputum will be there. Next, you can feel fatigue, or sometimes there will be crackles in the lungs. What are crackles? Crackles are some explosive sounds heard during breathing. Often they are described as rattling or bubbling or clicking sounds. Then if you see symptoms of right-sided heart failure, there will be swelling in the legs and feet, abdominal swelling, that is called as ascites. Sometimes there may be neck vein swelling, or sometimes there will be weight gain. These are some signs and symptoms of left and right-sided heart failure. Next, we will move on to investigations. Means the tests which are needed for diagnosing heart failure. They include ECG. ECG shows heart rhythm, how heart is beating. Then echocardiogram. Echocardiogram is done to know the ejection fraction of heart. Ejection fraction, the normal ejection fraction is 55 to 70%. In case of heart failure, it will be less than 40%. Then chest X-ray, that shows fluid collection in lungs. Then some blood tests also needed. They include kidney function tests or renal function tests, and some electrolytes are also needed to do the investigation. Next, we will see medical management. Heart failure is managed with medications, and sometimes they require surgical procedures. The drugs for heart failure includes Diuretics, what they will do? Diuretics remove the extra fluid collected in the body. Example include Lasix, Prismant, etc. Then ACE inhibitors can also be used. They relax the blood vessels. Example for ACE inhibitors is captopril, enalapril, etc. Then beta blockers are also used to slow down the heart pumping activity. Example includes metoprolol, succinate and all. Then digoxin, it also helps the heart pumping activity. Then surgical options include when there is involvement of any valve damage or any irregular heart beatings. Valve surgery requires when there is regurgitation or when there is stenosis of valve. In valve surgery, the stenosed valve or damaged valve is repaired. Pacemakers are also needed. They require when there is bradycardia or irregular heart beating. Sometimes, in severe cases, heart transplant is also needed. Next, we will move on to nursing management. As nursing officers, our role is to monitor and care the patient. Our role includes monitor vitals and weight daily, check for fluid overload, give medications on time, elevate head for easier breathing. As I told, there will be orthopnea, hence head and elevation is very important. Then educate the patient on diet and lifestyle. Diet modification and lifestyle modification is very important if the patient is a diabetic. Then limit the fluid and salt intake if advised by the physician. Then patient education includes teach the patient to eat a low salt diet, tell him to avoid smoking and alcohol, then advise him to monitor weight daily, then educate him also regarding recognizing the early signs or early warning signs of heart failure, then advise him to keep up with the doctor visits and medications. That's all about heart failure made simple. Don't forget to like, share and subscribe for more nursing lectures. Comment below if you have any questions or topics you want me to cover. Thank you.